increased glycated albumin, and decreased endogenous secretory receptor for advanced glycation end products, indicates increased risk of negative coronary artery remodeling in diabetics. Coronary arterial remodeling occurs at the site of atherosclerotic lesions. The glycated albumin is associated with coronary artery disease in diabetic patients. Endogenous secretory receptor for advanced glycation end products is a protective factor for vascular function in diabetic patients. The aim of the study was to evaluate the association between serum level of glycated albumin and endogenous secretory receptor for advanced glycation end products with coronary artery remodeling in type 2 diabetes patients. Type 2 diabetes mellitus patients with at least one intermediate lesion in non-percutaneous coronary invention, major epicardial coronary artery, were included in the study. Patients who had lesion with lumen narrowing more than 70% were excluded from the study. The study included 136 patients who had total 143 coronary intermediate lesions. The patients were divided into two groups based on type of remodeling. Negative remodeling included 81 lesions, and intermediate or positive remodeling included 62 lesions. Function in diabetic patients. The serum level of glycated albumin and endogenous secretory receptor for advanced glycation end products were measured. All patients underwent intravascular ultrasound. The mean serum level of glycated albumin was higher in negative remodeling patients than in intermediate or positive remodeling patients. The mean serum level of endogenous secretory receptor for advanced glycation end products were lower in patients with negative remodeling as compared to intermediate or positive remodeling. The results of the study concluded that negative coronary arterial remodeling is directly associated with increased serum level of glycated albumin and decreased serum level of endogenous secretory receptor for advanced glycation end products in type 2 diabetes mellitus patients. Glycated albumin and endogenous secretory receptor for advanced glycation end products are individually effective in predicting negative remodeling.